Hello,
Okay.
everyone. It's Kate Stillman with the Yoga Healer podcast, and I am psyched to talk to Dr. David Belk today about his book on the great American healthcare scam. I and Dr. Belk, you're a doctor. You received your medical degree, and you went into internal medicine and private practice, you and then tell me, how did it happen that you got demystified and went into research around what's going on with the American healthcare costs and the healthcare system?
Well, it was a number of things that sort of led me to become interested in it. One was I noticed a very long time ago, even when I was a medical student or resident, that most of the medical bills that seemed, so outrageously high weren't really being paid by most of the insurance companies in full. In fact, only a small percentage of them ever seemed to be paid. And I thought, well, that's a little bit dishonest. And then when I found out that the majority of medications, prescription drugs that are bought and sold in this country are generic, and in fact, most of these generic medications only cost the pharmacies pennies a dose. Therefore, most of the talk about the high cost of prescription drugs only applies to a few medications, yet everyone seemed to think it applied to all medications, was also extremely disingenuous, if not dishonest. And I thought, well, I could put all that out there in a website. Maybe people would find out and, start to realize when and how and by whom they're actually getting ripped off. Because not knowing who is ripping you off makes it very, very difficult to, well, do anything about it. And it's been going on for at least 10 years, the website anyway. And then last year I put out a book that you talked about, the Great American Healthcare Scam. It's basically just about all of the different ways all of the industries in healthcare are deceiving everybody and robbing them. We all like to point to the pharmaceutical companies, and of course, they do a lot of bad things, but they are nowhere near the only problem in healthcare. And most people simply don't understand all of the different complex ways in which every industry in healthcare is robbing you.
I watched a bit of your video on YouTube on the Great American Healthcare Scam, where you go through the billing and
Mhm.
the line item by line item of these things that show up on a medical bill, and how the majority isn't paid by anyone. When did that start?
Well, you could pretty much say that payments on medical bills started to break away from medical billing charges way back in the 1980s, when different payers, Medicare and the private insurance companies, started paying by different systems. I talk about this in my book. In fact, I write an entire chapter on it called "The Evolution of Overbilling," where I talk about how back in around 1983, Medicare started implementing a policy called the DRGs, the diagnostic related groups, where instead of paying a hospital for what it did for a patient, they would pay a hospital based on the diagnosis. The reason Medicare did this was because, in the 60s and 70s, shortly after Medicare was implemented, they gave the hospitals and the doctors kind of carte blanche in terms of how much they would uh, compensate for any necessary medical expenses. And hospitals and doctors started inventing necessary medical expenses all over the place, and hospitalizations started to explode. This was really an era of overutilization. And so Medicare decided to clamp down on this by saying, okay, you can only hospitalize people for certain medical diagnoses, and we will pay you for the diagnosis. Do what you think is best for the patient, but you get a package deal for each diagnosis. Well, Medicare started doing this, whereas the other insurance payers, and there were multiple payers, were still kind of paying by the old fashioned system of, pay for the day in the hospital, pay for the services done. And because you had different payment systems, the billing charges started to become, instead of sending one set of bill for one type of payment and another set of bills for another type of payment. They just started to combine all of the billing charges, which turned into this sort of amalgam of redundant charges. Well, then, I sort of itemize all of the different changes in regulations and standards and how the hospitals compensated. And for the most part, they compensated by just accelerating their billing charges way away from the expected payments, to the point where in one of my videos, I described it as the kitchen sink method of billing. No hospital has a good idea of what they will get paid for on any given billing charge, or even if they'll get paid for it. So they throw everything into the bill that any payer might pay in an amount well over what the bill or what the payment might be expected, and take what they can get. I sort of call it the kitchen sink method of billing. And this has caused billing charges to average 4 to 5 times expected payments in for most hospital bills. And this is inpatient, outpatient, whatever. But you can never predict, based on the billing charge or even the medical service provided, how much might be paid on any given medical bill. And of course, the examples that I give in my book and in my video, well, the first one is, truly insane. I show a $97,000 bill for someone who received no more than 1 hour of outpatient sinus surgery. And the billing charge was $97,000, but the eventual payment was only about $4,450. 95% of that entire bill was simply discounted, disregarded. It didn't exist. People ask me, oh, well, where did that $92,000 go? Nowhere. It was a work of fiction. It's like asking, where do Santa's elves go after Christmas? Santa doesn't exist. These billing charges don't exist. But what you need to understand is that it is nearly impossible to predict the eventual payment based on the billing charge. I give other examples of, bills that are compensated at 15% or 30% or 60%, 90%. So sometimes more than 90% of the bill is paid. Sometimes more than 90% of the bill is discounted. And my favorite example that I always like to show people are these two medical bills for women who are patients of mine. Both have United Healthcare as their insurance, same insurance company. Both received hysterectomies. Both received their hysterectomy at Altabates Summit Medical Center in Berkeley, California. Same insurance, similar procedure, same hospital, right? What was the difference? One of the women was a simple procedure. She received it as day surgery. Checked in that morning, home by noon the same day. The other woman, somewhat more complicated, she had a 3-day hospitalization. As you would expect, Altabates Medical Center billed United Healthcare far more for the 3-day hospitalizations than for the day surgery. It was over $86,000 was the billing charge for the 3-day hospitalization, whereas only $41,000 was billed for the day surgery, where the woman was home by noon the same day as she checked in, right? Okay, what you wouldn't expect was that United Healthcare agreed to a total payment of more than $29,000 for the day surgery, whereas less than $13,000 was paid between the patient and the insurance company for the 3-day hospitalization. So only 15% of the bill was paid for the 3-day hospitalization, which was less than half the amount that was paid for the day surgery. How does that make sense? It doesn't. It's random, it's chaotic, it's completely unpredictable, and that is by design, because if you have absolutely no idea how much ought to be paid on a medical bill, you will never know when you're being overcharged, and that's the point. You are being overcharged most of the time. You have no way of knowing, and there's practically nothing you can do about it.
It's so interesting to hear this, because I live in the U.S. and then I live part-time in Mexico, and over the last decade I've just done all dental and medical in Mexico, because you can get a price before a procedure.
Yes.
And you can talk to multiple doctors and hospitals, and you can, and it's a free market and
Right.
you pay. And it's like, I had a surgery, I had a tumor in my tibia bone. It was on my growth plate. It was a cartilage tumor, slow growing since
Yeah.
puberty. And we just found it. Right. And the whole procedure, it was $3,000, and I paid in cash. It included the x-rays. It included like all the things that I needed. Same day in, out, great facility, blah, blah, blah. But you know what you're going to pay before. And here I called my insurance and this and that, and I just couldn't get an honest answer.
Right. And they won't give you an honest answer because that's the last thing they'd ever want you to know. But the point is, and this is really important to understand, because a lot of people say, yeah, well, why don't we turn the whole thing into a free market? Free market is great, I suppose, in cases of elective outpatient procedures, simple tests, all of that. And I give a lot of information on how you can make that work. But it absolutely doesn't work in emergency cases, in acute care medicine. Obviously, if you're having a stroke or a heart attack, or you just broke your hip, you can't go from hospital to hospital and start asking
Right.
about prices.
Yeah.
Try discussing prices while you're in a coma. Try discussing, which medication you want when you're in the ICU on a ventilator. Okay, these things aren't possible, and this is where they get you. When you need care now, you can't be talking about price. And so, first of all, even with the outpatient stuff, they get you a lot of the time because it's so confusing. You never know what you might pay. And much of the time, in fact, I give examples throughout my book, throughout my website, throughout my video. You would have been a lot better off if you had said, I don't have insurance, and negotiated a cash price for a lot of the outpatient procedures. But everybody tends to trust their insurance. And of course, in the introduction of my book, I give one of my favorite examples. A patient of mine has migraine headaches, and they've been pretty bad. I mean, she's had them since she was a teenager, but fortunately for her, there's a medication that works really well for her. It's called Maxalt. The generic is rizatriptan. It's been generic since about 2013, which is really good. So it's about 5 years ago. I wrote her a prescription for 40 generic rizatriptan pills, which is several months' supply since you only take it once in a while. And she went to the local Walgreens, handed them her insurance card, and handed them the prescription. And the first thing Walgreens said was, "Oh, this isn't covered. You can't buy this." And she said, "Oh, okay, how much is it cash?" Walgreens tells her it's nearly $1,500, $1,500, $1,489 for 40 pills, right? $37 a pill. And she's like, okay, I'm out of here. Well, so that day, I go through the process of authorizing it, making the insurance company reconsider, saying, no, she needs this medication. Could you please cover it? Now, I knew what was going on the whole time, but I went through the motion anyway. And her insurance company says, okay, we'll cover it. It's a generic medication. There shouldn't have been a problem. But anyway, she goes back in the next day with the authorization and her insurance card and the prescription. And they tell her, all right, well, it's covered, but the copay is $168 and you can only buy 10 pills for that. Can't buy all 40. We'll just sell you 10 and it's $168 copay. So now we're talking $16.80. And I said, forget about your insurance. Take your prescription down the street to Costco, not Canada, Costco. Okay. Hand them your prescription and tell them you don't have insurance. So Costco sells her all 40 rizatriptan pills for a cash price of $41.28. All right. So that's it. In other words, all pharmacies pay pennies per pill for generic medications. And when I say pennies per pill, for a lot of the standard blood pressure and diabetes and cholesterol medications, it's less than 10 cents a pill. It's often less than 2 cents a pill. Now, some medications like antibiotics or this migraine medication that you only take once in a while might cost 50 cents a pill, or maybe up to $1 a pill, which is what a rizatriptan costs. But it certainly doesn't cost more than that. Now, that's for generic medications. What people don't understand is that the brand name medications aren't 50 or 80% more. They are on average 100 times the price of a generic medication, even when it's the exact same medication. So 10,000% more. That's how much pharmacies pay. All right. You talk your generic Lipitor, atorvastatin, pharmacies pay about 8-9 cents a pill for that. If you talk your brand name Lipitor from the Pfizer company, pharmacies pay $12 per pill for that. $12 versus 9 cents. You talk your generic Viagra, everyone's like, oh, you can get Viagra for $5 a pill. No, you can get Viagra for 40 cents a pill. Pharmacies pay about 35 cents a pill for it. And you can get, 100 Viagra at Costco for about, $42. And whereas they pay $60 a pill for the brand name stuff. Okay, so on average, a pharmaceutical company will charge literally 100 times as much for a brand name medication as they will for a generic. Now, since nearly 90% of all prescriptions filled in this country are for generic medications, 90% of the time you fill a prescription, the prescription you are getting costs the pharmacy only a few cents a pill, or maybe up to $1 a pill, but that's as much as it would cost, right? So people go all the time to the pharmacy and they show an insurance card and they buy 30 blood pressure pills for $10 or maybe 90 for $20. And I tell them, you can buy as much as a whole year's supply at once of that without your insurance for 25 bucks. Did you know that? And I show them how. And you just say, well, I don't have insurance. I'd like to pay the cash price. $25 for 365 pills for their blood pressure pill, or $20 for 90 pills. Some people pay $20 for a month's supply. The copays on most generic medications are inflated well beyond the actual cost of the medication. And not only that, to bring things even further, when you pay that $20 copay for 30 pills that cost the pharmacy only, 80 cents, the pharmacy doesn't even keep the whole copay. They split that copay with your insurance company. The very insurance company that was supposedly giving you coverage actually gets what's called a clawback. So they'll take, 20 or 40 or 60% of that copay back from the pharmacy and keep it. And that's their compensation for inflating your copay on a medication that never should have cost you any more than aspirin. And, they do this. It's called a clawback. And this happens on literally 23% of all prescriptions filled in the United States. Not only is your copay more than it ought to be, the very insurance company that determined that copay that robbed you gets a cut of that copay as their compensation for ripping you off or helping a pharmacy rip you off. So everyone says, oh, these drug prices are so high because of the pharmaceutical company. For the 12 to 13% of the prescriptions that are brand name that are filled, that's the truth. But 88% of the time, it's the pharmacy and your insurance company that's robbing you, not the pharmaceutical company. All right?
Yeah. Crazy.
Yes, very crazy.
So in terms of the typical person who just feels trapped, right? Just trapped with, I need insurance. I mean, actually a lot of people in my community have, they don't have insurance coming from work. They're self-employed. And so it hits them really hard, right? In terms of getting your own insurance. It can cost upward of $20,000 a year just to have insurance.
Exactly.
That has a copay. So for me, I just, I have catastrophic, but I also know that like any sort of outpatient thing I'm going to do, I'm not going to do it in the United States because it's ridiculous here. And I know that most people don't have the freedom to make these kind of choices. So what is the typical self-employed person? What are their best choices?
Well, yeah, you need insurance because of those acute problems. I mean, you get diagnosed with a cancer, or you get a heart attack, or you get some sort of lupus or something like that. I mean, people can get very, very unlucky. Good health is to a large extent a matter of luck. And if you do get unlucky, this could cost you hundreds of thousands of dollars. And if you don't have insurance, you don't have the privilege of being able to negotiate for life-saving medical care very much. I mean, it's not in your favor. It's not like, calling around and asking for the price of a CAT scan. You might need, hundreds of different medical services over several years, and you really want to pick up the phone and negotiate with each individual entity to, that's responsible for your healthcare. I mean, one of the examples that I put on my website is this woman. Now, she had Medicare, which was a great deal for her, and she needed a liver transplant for liver cancer, right? So she had, she first needed chemotherapy. She needed radiofrequency ablation therapy. She needed multiple tests to work up stage her cancer, all of these treatments. She needed a liver transplant. She had a complication after her liver transplant that caused her to be in the hospital for like 6 weeks. All of these things going on, right? And among other things, I added up all the medical services. Incidentally, she's fine now. I mean, this happened like back in 2017. And over the last 3 years, she's been on a blood pressure pill and, a anti-rejection medication, both of which are generic. And she's needed almost no medical care at all other than, routine follow-ups.
Wow.
So she was cured. Great. But over that 2 years that she was being treated for her liver cancer up to and through, the liver transplant, she received a total of 330 medical services in 2 years and racked up billing charges of more than $1 million. And there was a total of, I counted more than 50 individual providers who billed for their services. In other words, of all of the, in other words, it isn't just going to your doctor and saying, hey, can I have a new liver? I mean, you have such a gargantuan number of individual players involved in your medical care for any complicated care. And many of them you'll never meet. Many of them your doctor will never meet. Okay, the pathologist who looks at the slide and makes the diagnosis, the pharmacist who fills the pills, the radiologist who reads your MRIs, your CAT scans, your, all of these people. Okay, you're never going to meet them, let alone negotiate with them.
Mm-hmm.
All right. I mean, even something as simple as a pap smear. I mean, sure, the doctor could do it for free, but then he's got to send the slide to a pathologist to read it, right?
Mm-hmm.
And the doctor's probably never even going to meet that pathologist, let alone say, hey, could you give her a cut on her bill, or something like that, right? So lots of what we do is so remote from the patient that it is extremely difficult for any procedure that isn't just simply, an in and out, obviously if you get an x-ray, then you can call an imaging center, or if it's just buying a generic medication, you're dealing with one player.
Mm-hmm.
But in any complicated medical care, you have multiple players whom you'll probably never meet or even know who they are. And even your doctor will probably never meet many of these players.
Mm-hmm.
And they'll all be sending you bills if you need complicated medical care and don't have insurance.
So what's the answer?
Yeah, we need to fix the system. And it's an incredibly complicated problem because currently the law is on their side. Whenever I present all of these
On their side, you're talking like the whole
on the side of the healthcare system robbing you. And whenever, I present
mostly the insurance companies, is it mostly the
everything? The insurance companies, the hospitals, the pharmacies, everyone who's involved in this, they're not doing anything illegal. Mm-hmm. They're not doing anything illegal. And I guess if you wanted to boil it all down to, 3 basic problems, one is about half the money that goes into healthcare in the United States goes towards fraud. Flat out blatant fraud. And if you don't think that what I'm describing to you is fraud, then, look up the definition.
What falls under that category? Like what?
Well, fraud is simply a deception that's, designed to rip you off, right?
Mm-hmm.
And
So this is very deceptive. The billing to the to the communication,
to the
to
pricing, to everything. Exactly. I mean,
the
these are
advertising.
very, very deceptive practices because obviously very few people understand them. That's makes them deceptive by definition.
Yeah.
And it's robbing us because we spend twice as much on healthcare as any other developed country, and our outcomes are hardly great. I mean, we don't have a whole lot to show for all the money we're spending.
Mhm.
And it's clear from the multiple examples that I give, people are getting robbed. They're getting grossly overcharged, and they're getting grossly overcharged largely as a result of these deceptions that
Mhm.
take advantage of not just their ignorance, but their misinformation, right? So about half the money that goes into healthcare goes towards fraud. The vast majority of that fraud is completely legal, so you have no recourse if you've discovered that you've been defrauded. And most of the people who are benefiting from most of the fraud are running the show, meaning they're pretty resistant to there being any change.
Yeah.
And you know what? One of the more pervasive and insidious problems with healthcare, I try to outline in well, really the second chapter of my book, and one of the pages in my website. You know, I call the second chapter of my book "The Chaos Up Close," where I describe in rather meticulous detail why your doctor has no idea how much he's likely to be paid for seeing you as a patient.
Mm.
Even if he knows what your insurance is and what he sees you for, he puts in the billing code and then it's like it's just random how much he gets paid. Okay, when you have a system in which most of the players within healthcare actually don't understand how they're paid or how much they're going to get paid,
Mhm.
and to a excuse me, to a certain extent, they're all benefiting from the fraud even if they're not totally aware of it.
Mm.
And that's another thing.
You mean
So
the doctors in this case?
the doctors, yes. I mean, they don't understand the system very well. So they don't even understand totally where their money is coming from. What
Mhm.
that means is that any reform system that you try to install in healthcare, you don't know, and the people within healthcare don't know who's going to benefit and who's going to lose.
Right.
And of course, if you suddenly suck half the money that's going into healthcare out of it, I guarantee you large numbers of people are going to lose a whole lot.
Yeah.
And nobody really quite knows how much they're going to lose by any reform system. Well, that makes the entire healthcare system, which is a $3.5 trillion economy, very resistant to change because they don't know how the change is going to affect them exactly, because there is so little transparency, there's so much deception. You know, the fraud is so pervasive. It's not like, you know, instituting a Medicare for all system is going to put, you know, the CEO of Anthem and United Healthcare in the soup line and not, you know, affect any of the rest of us. It's going to affect large sectors in ways that even they don't understand.
Mhm.
And that makes change incredibly difficult. And so the first thing you got to do is you just got to open up all of these finances and allow everyone to examine them. Now, interestingly, you know, a bill that was passed a couple of years ago by HHS under, of all things, the Trump administration, actually mandated that hospitals have to start to put out their negotiated rates, and they're starting to do it. They're very reluctant about it, but they're starting to do it. And I've seen some of the spreadsheets. Of course, it confirms everything that I thought, and then some, to look at these spreadsheets. But they're quite complex, and they need to be sorted out and analyzed. But that is a huge step, believe it or not, towards what might be a solution to the problem. But you got to kind of stay tuned. But yeah, the fact that everything is going on behind the scenes in the dark, you know, under the curtain, you know, it's all being it's all um so opaque, makes any reform to the system very risky because it's hard to predict the consequences of the reform.
Yeah.
And that's why so few politicians, even ones with good intentions, you know, eventually back away from any significant reform. They're not sure how it's going to affect the system, and you know, you don't live long in politics if you're not risk averse. You
Yeah.
know.
Yeah. Wow.
Yeah.
So is there any, I mean, we've seen certain industries get blockchained. Is there any chance of that happening in healthcare where there's, where it is more transparent or more
Well,
altruistic?
well, like I say, the fact that the hospitals have to put out their negotiating rate is a huge step towards transparency. And there are other, Medicare, CMS since 2012 has actually had a website or had a link called the National Average Drug Acquisition Cost, where you can download and look at how much pharmacies pay for every drug medication they buy,
Mm.
which is a huge, which has always been a huge step towards transparency. Websites like goodrx.com put out the cash price. All pharmacies, in the area will list for the medications they sell if you want to, pay cash and use a coupon. Of course, a corollary to that is you can't show the pharmacy an insurance card because a lot of the pharmacies would feel obligated, whether they want to or not, to use your insurance if you have it. But if you just say, hey, look, I don't have insurance, then you can often pay the cash price, which is probably in most cases of generic medications, quite likely less than your copay. So there's a lot of entities out there are putting out these costs one way or another. But one of the things, for example, in pharmaceuticals that you really can't do much about yet is the fact that your insurance company, well, the pharmacy benefit manager, which is, who your insurance company uses to, mediate your medication buy purchases, your insurance company actually gets rebates on the brand name medications that you need. So if you do need a brand name medication, they get upwards of 40% rebate on that medication, whereas your cash price is in many cases 2 or more times what your insurance company would pay for it. So, and this is one of the reasons brand name medications are so expensive in this country. Your insurance company isn't interested in buying the least expensive medication. They're not shopping for lower prices, they're shopping for higher rebates. And since rebates are based on the cost of the medication, higher price medications yield higher rebates, and therefore your insurance company is selectively driving those prices up. That's why brand name medications are so expensive in this country. Your insurance company that determines which asthma medication or which type of insulin, they're actually motivated to shop for higher, not lower prices. And so if a pharmaceutical company wants to attract them, wants to get first tier in their listing, they do so by raising, not lowering the price. That's why you've seen such a skyrocketing in brand name medication prices over the last 20 years.
Hmm.
Yes.
So you were going to also talk about Medicare or Medicaid.
Right. Well, the most important thing that seniors need to understand about Medicare is that it's the single best deal they will get in the United States for their health care. Now, I'm not saying Medicare is perfect, okay? But about 6 months before you turn 65 and qualify for Medicare, you can count on having a barrage of phone calls and mailers and all kinds of information, just a barrage of insurance companies trying to sell you Medicare supplemental policies, Part D plans, Medicare Advantage policies. I mean, you see the TV commercials all the time, right? They sell Medicare Advantage like, they're trying to sell timeshares in Aspen, right? It's just a huge amount of focus on trying to attract Medicare recipients into these privatized policies. Now, that should make you wonder. First of all, you never stop hearing about how insurance companies hate pre-existing conditions, right? Oh, they don't want to cover pre-existing conditions. Oh my God, if you've ever had a cold in your life, that's a pre-existing condition. They don't want to cover you, right? And yet, about 6 months before you turn 65, suddenly all the insurance companies want to sell you this extra health insurance. Now, can you imagine a pool of people with more pre-existing conditions than people over 65 or the disabled, which is who Medicare covers? So why are they suddenly flocking to cover all of these pre-existing conditions? If once you go on Medicare, you're just going to get older and older and older, and chances are you're going to get sicker as you get older because we all get old. Well, why are the health insurance companies scrambling to sell policies to these people with who, being over 65 is a pre-existing condition by definition, whereas hey, you once had a headache when you were 35, that's a pre-existing condition. They don't even want to touch you. You have high blood pressure. Why, you could be on high blood pressure pills for $25 a year for the next 40 years. That's a pre-existing condition, right? It doesn't make any sense unless you realize these policies are a complete ripoff. And I itemize the many ways in which these policies rob you and deceive you, mostly by making you think you are far more responsible for your medical bills if you have only Medicare than you really are. Medicare has a very, very clear-cut, transparent system of paying. It's complicated, but it's very transparent. They will tell you exactly how much they approve in payments on any medical service, and you only owe 20% of what they approve. Well, Medicare on average pays less than 20% of any billing charge. Okay, billing charges are works of fiction, and Medicare doesn't pay any attention to works of fiction. All right, they have a set price for every medical service, and that set price is usually about a sixth of what the billing charge is. Well, you're only responsible for 20% of that 1/6, right? A fifth of a sixth or a 30th of the total amount billed. So you're not responsible for 20% of an $800,000 hospital bill. In fact, for hospital bills, Medicare has a single payment that they approve of. It is your Part A deductible. It's $1,484 that you owe on any hospital bill if you're hospitalized, regardless of how big the bill is, right? So if you're hospitalized for 4 weeks and you run up a $700,000 hospital bill, how much do you owe the hospital? $1,484. If you're hospitalized for 6 weeks and you run up a $700 million hospital bill, you owe the hospital $1,484. If you're hospitalized for 8 weeks and you run up a $700 trillion hospital bill, or if your hospital bill is 8 times the national debt, you owe the hospital $1,484. It's not 20% of anything. Seniors don't understand this. And these insurance salesmen are very, very aggressive in making the seniors think they'd be responsible for 20% of a $700,000 hospital bill, which is $140,000, not $1,400. And it's a little like, I always say, imagine you're buying car insurance and you think you're purchasing insurance on a Lamborghini when in reality you have a Honda Civic. Mm-hmm. Okay. They're kind of selling insurance that way.
And that's legal.
Of course it's legal. And that's what's wrong with our system. It's highly deceptive, highly disingenuous. These medical bills scare the piss out of everyone, but they're not meant to be real. Of course, they can become real. Like I say, if you don't have insurance and you're brought to the emergency room and in a coma, you don't have a whole lot of leverage to negotiate that bill. And the people who get stuck the most, I talk about this in my book. You have insurance and you go in for a procedure and suddenly you find out, oh, you were out of network, or oh, the doctor put the wrong billing code or something like that, some snafu. And the insurance says, man, not everything was done right, we're not going to pay. In that case, where you used your insurance and your insurance company basically bailed on you, you always end up with the full billing charge. You have no room to negotiate.
Wow.
And people don't understand that. If you use your insurance, you are contracted by your insurance rules, not just their rates. And their rules state that they will negotiate any medical bill they approve, but if they don't approve, well, sorry, the whole bill's on you, and the hospital isn't allowed to cut you a deal. Now, maybe the hospital could anyway, but for some reason, they're never all that willing to once the insurance company says you owe the full price.
Wow. Of the
Yes,
fictional bill.
of the fictional bill. So
That's
it
5 to
becomes an
6 times
absolute
higher
reality. Yes, it
than
becomes
what
an
the insurance company would have paid in the first place.
Yes, it becomes an absolute reality if you use your insurance and your insurance says you broke any arbitrary rule that they put out there.
So are other countries experiencing this, or is this
No,
just a unique United States problem?
I would say it's about as unique a problem as I ever encountered. Yeah, we have a system. It evolved this way out of a series of, I suppose, random accidents and events more than an underlying conspiracy. I talk about how most of this insanity evolved over decades,
Yeah.
and it almost certainly wasn't planned in advance because this is just too strange for fiction. People don't have the sort of imagination to see how crazy this is. But as it evolved, more and more players figured out ways to take advantage of it,
Yeah.
leverage it, accelerate the problem, increase the opacity. It's simply, most conspiracies don't happen because people plan them in advance when they're this complex. Most of them simply happen because certain entities figured out how to leverage, loopholes and just bad incentive structures to their advantage. And then once they do, they just start kind of milking it more. And here in the United States, we've just run into the absolute extreme of this. And like I say, it currently costs us about twice as much as is paid, in any other country. And it's such a complex and opaque and gargantuan system. Reforming it is far more complicated than most people would think just by looking at it superficially.
And so are all the insurance companies equally, I would say, corrupted, I guess, at this point, or fraudulent?
Well, why wouldn't they be? I mean, like I say, nothing that they're doing is illegal, and they're in it for the money, and this is how you make the money.
Yeah.
I mean, if and how
There's
easy how
nothing
hard.
anyone should associate with healthcare with altruism or with making or with caring for people. We'll just put it that way, for caring for people's health.
It's hard to survive in a system where fraud is legal, where you want to be the honest person. It's kind of
Yeah.
like trying to compete in a sport where steroids are allowed and you decide to go without steroids. You're going to
Yeah.
lose every time,
Yeah.
right? And so that's the problem. Once you make fraud the norm, anyone who says, "Well, I want to be the honest person," they usually end up getting squashed like a bug sooner or later.
Yeah.
They don't grow very fast and they get absorbed quickly
Yeah.
because
Yeah.
the fraudsters like to take out the honest people any way they can, and they're pretty good at it.
So it doesn't seem that, the state of the system or the state of paying twice as much as healthcare is helping people make better decisions about their health on a
Oh, hell
personal
no.
level.
Not even close. I mean, who would want to go to the doctor when, you go in for a free visit and you end up getting a $200 bill? I mean, the surprise billing is such a sucker punch. Even if it doesn't hurt you financially, it usually ends up alienating so many people so much they'd rather not go to the doctor again until, they're peeing blood or something. I mean, it's just, you
Right.
don't want to go to the doctor when you know that no matter what you do, you're probably going to get sucker punched.
So therefore preventative care is on the decline.
Not most of the preventive care we need, fortunately, is in Medicare recipients, and Medicare is still one of the good guys in the whole system. And to a large extent, Medicaid can't prey on people because it mostly goes to the poor people who don't have that much money to take.
Yeah.
So you could say that within the commercial insurance business, the people who get their insurance from work, some people still have really good policies that don't take advantage of them that often, but so many people are getting taken advantage of so often that it's really kind of winnowed away the number of people who would want to use healthcare for, like you say, preventive services, the sort of thing that they ought to. um, it's hard to quantify those things. I mean, if you look at the people who do utilize healthcare, a good part of them are still, receiving good care. You look at the people who are marginalized and cut out of the system. Well, some are lucky and just don't get sick. It's a bit difficult. I mean, the one thing you can say is that for the most part, our healthcare system is alienating a good portion of the people who ought to be using it or, might need it.
Yeah.
And it's costing way too much for all of us. I
Hmm.
mean, those insurance premiums are insane, even
Hmm.
if you never get sick,
Yeah.
just having to buy the insurance to hedge against any, disease that might hit you like a lightning bolt. Uh, it's just way too much.
Yeah. Yep. Amen. Well, I'm so glad that I've had you on the show and getting the lowdown on just really how bad it is.
Mhm.
So, do you think it'll get worse in your lifetime or better?
It's very hard to predict.
Hmm.
It's at some point you hit that breaking point, but you never know when that breaking point is. And sometimes the breaking point is a meltdown in the system, like you had in the housing market a little more than a decade
Yeah.
ago. I
Yeah.
mean, it's like eventually all fraud and all scams, end up self-destructing. It's
Yeah.
just a question of how far will this go before it does. And possibly, this hospital transparency issue might be a game changer. And then again, it might not. I'm currently, kind of working on that with some other people, and maybe, we can do something about it. But another issue is more and more employers who provide most of the commercial health insurance in this country. More and more employers are realizing that they're getting robbed blind,
Yeah.
and I'm demonstrating to them, or at least I'm trying to show them exactly how they're getting robbed, and some of the things they might be able to do about it. Because you know the huge employers in this country, they're kind of the titans that can take on the titans, the
Yeah.
health insurance company.
Yeah.
And there are more of them than there are health insurance companies. Once they realize exactly how they're getting robbed, they
Yeah.
have a lot more power to do something about it than, say, you or I do. And
Right.
so, to a certain extent, being able to demonstrate that might change the system. Now, whether or not it changes the system for the better, I mean, obviously, employers don't have your best interest in mind either. So it may cut down the price, but it may, drastically reduce the services as well. It's, again, it's not just a huge problem, it's a remarkably complex problem.
Yeah.
And that's what makes all of this so difficult to fix. As I often tell people who say, well, how can I fix this? If it were easy, someone would have already done it.
Yeah. 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 It sounds like taking good care of yourself is a really good strategy as
Well, it's a
far
good,
as it can get you,
yeah,
like
but
you said, there's
still,
random, yeah,
there's random
there's random
random things
stuff.
that can hit you
There's
no
car
matter.
accidents, there's all the, yeah, there's all
There's
that.
there's random cancers. A lot of life is luck.
Yeah.
If you've ever played poker, you can sometimes win with a pair of threes. You can sometimes lose with four aces. It's not, no matter how well,
Yeah.
your hand looks in the beginning, there's random luck that plays a big role in all of us.
So how do you personally stay positive while taking on this massive problem?
Uh, well, if I told you I was always staying positive about it, that'd be a huge lie. There are
Well, I just
definitely
mean
mornings
like,
when I wake up
yeah,
and just say, yeah, it's just all gonna, but then there are times that, I find things that I do that I say, well, this might work. Well, this might work.
yeah,
I mean, I've done, in 10 years of research, the amount that I've uncovered, whenever I go over it with people who, want to try something to fix the system, all of the stuff that I'm uncovered, they're like, oh my God, you did all of this. And I feel like, well, maybe all of this will prove useful,
yeah,
and maybe my book will prove useful.
yeah.
But
Well, I'm sure it will. I want to connect you with Ralph Moss of Cancer Incorporated, the last guy I
uh,
interviewed, who has done a lifetime of research as well, but particular to the cancer industry. It seems like, more of these books and with social media and YouTube and channels getting, more accessible for people to be informed that people like you are doing just great work in the field, and we all, I think, are appreciative of it.
mhm. Yeah, information is out there. Unfortunately, misinformation is out there as well, and it's kind of hard for most people to know which is which makes it much more difficult, because For every source out there that it tells you exactly what's going on, there's 4 or 5 sources to throw sand in your face.
Yeah.
It's the problem with the internet is that it's an ocean of stuff,
Yeah.
and most people just don't have the ability to really sort fact from fiction well enough, especially in a system as complicated as healthcare.
Yeah. Well, and especially with advertising being as good as it is these days, in terms of being convincing and the amount of money in it. So,
Yeah.
well, thanks for your time, Dr. Belk. I really appreciate it.
No problem. All right. It's over.